Bismillahirrahmanirrahim. So from today we'll start spatial histology. And when we say spatial histology is when we start dealing with the organs and when we start dealing with the systems. So before that, what we were doing actually, we were explaining you, teaching you the basic tissues, individual tissues. We started with the cell, then the first of the basic tissues, epithelium, you all know, different types, their locations, functions, details of their structure, followed by the second of the basic tissues, connective tissue, and once again the details of the connective tissue, cells and fibers, the classification, then the muscle, different types of the muscle, the nervous tissue, the details of the nervous tissue, and after that in MSK block, specialized forms of connective tissue like different types of bones, cartilages, etc., etc. Am I right? Now, we will start spatial histology. Spatial means we will choose an organ from a system. The system here is GIT. We will be selecting organs and we'll see how the same basic tissues are arranged, are organized into that particular organ. You understand what I'm saying? The same tissues will not go into the details of the basic tissues. Instead, we will be explaining you how these tissues are arranged in that particular organ. Okay? So we are going to start with the oral cavity, the first part of GIT, because the process starts with ingestion and then katakat, like fragmentation, and then moistening, and then partly digestion like this. Okay? And then followed by other processes of digestion. Mostly it is physiology. So what I'm saying is that we'll start with the oral cavity. Okay? So I'll show you the first slide. See, I'll start with this just to show you. It's a sagittal section. You can see the lips, yes? As you enter in, you can see teeth, and then as you enter in, you see a space. Then there is a roof of the oral cavity formed by the hard palate. There is a bone. Then posteriorly there is soft palate. Am I right? This is simple. I'm not teaching you anatomy. Then there is a very important organ inside the oral cavity called as tongue, the tongue. And then this is called as the floor of the mouth, floor under the tongue. And then there are walls. They are nothing but the inside of the cheek. So oral cavity has got a roof, a floor, side walls. It has got an opening, anterior opening, and the posterior opening leading it into pharynx. Oral cavity has some structures. They are called as hard palate, soft palate, tongue, lips, teeth, gums. These are all structures which can be seen, which can be identified in the oral cavity. Is that clear? So okay, now what I'll do, look at this. Mouth opened, like this, so that you can see there is some membrane lining these oral tissues. Am I right? There is some membrane. As soon as we open the mouth, we can see there is some membrane lining all the structures of the oral cavity. What histological structure lines all cavities? Thank you very much. So what is the first tissue? Tissue. Without mentioning the type, just name the first tissue that covers all these structures. Epithelium. So whether it is hard palate, soft palate, lips, cheeks, gums, tongue, any surface of the tongue, whatever organ I give, whatever tissue I give to you, and I ask you see it under the microscope, so at least you can tell me the first tissue layer. All of them are covered by what? Thank you very much. This is one. I did not mention teeth. Okay? Except for the teeth. Okay. The gums. As per rule, what is the second tissue that always support epithelium? You tell me. With no exception. Wherever there is epithelium, the second tissue has to be. Type can be different. I'm not saying the type. I'm not asking you the type. So okay. So all these tissues, whether roof, wall or floor, are having second tissue as what? connective tissue. So now you know the histology of all these structures. At least you know how many tissue layers? 2. That there has to be epithelium, there has to be. Thank you very much. Now, the next slide that I will show you, you will see a term. Let me show you this. Let me show you. Okay. Oral tissues. The first is what? Oral mucosa or mucous membrane. Second is lips, teeth, tongue and salivary gland. These are the structures present in the oral cavity. Now, what is oral mucosa? The first 2 tissues, functionally they act as one membrane. You cannot separate them. They work together. They act as one layer, one membrane. And this membrane covers all oral tissues, of course, except for teeth. Okay? So this combination of 2 histological tissues is called as a mucous membrane, or in short, mucosa. Because it lines the oral cavity, it is called as oral mucosa. It's a simple histology. The first 2 tissues in the oral cavity are called as mucous membrane. Is that clear? Now, remember it's a cavity, oral cavity. It's exposed to the external environment. I don't know, what is your concept? All openings of the body are protected by stratified squamous epithelium. Because the stratified squamous epithelium is a protective epithelium. It's multi-layered, many layers. It is designed for protection. Because oral cavity is near the external environment, always exposed. We all the time eat, drink, chew, speak. So there is friction effect there. So Allah subhanahu wa ta'ala has provided this. So what is the type of epithelium? Now I'm asking you without telling you. What epithelium do you think will line the oral mucosa? Which is a protective type of epithelium. Okay, so definition is written here. You can read, you can easily understand. Now, before I explain you the types of the mucous membrane, I would like to show you this slide. Can you see this? Is it very clear? Now, what is this tissue? You tell me. What type of epithelium is it? Multi-layered, many layers. Is it clear? Now, what tissue is it? Connective tissue. What do you think? What connective tissue, what type of connective tissue is expected here? Loose or dense? Loose or dense? Why loose? This epithelium is for diffusion. Do you need the protective epithelium for diffusion? It is never, ever for diffusion. For diffusion, we need a simple type of epithelium, minimum number of layers, so that the fluid or air can exchange. Multi-layered epithelium is never for diffusion. It is for protection. It is for protection. Physical, mechanical, thermal, radiational, all type of insults. It can. Okay? Now, remember, there are some rules which govern the structure, the body. My dear, this epithelium is stratified, so many layers, and you want a tissue to support it. Support. See what effect I'm trying to give. Support, hold. Can a loose type of tissue support this much thick epithelium? Yes or no? Loose is for simple type of epithelium in general. For this much thick, you need this much thick connective tissue, a dense connective tissue. Dense. You understand? For stratified epithelium, dense. For simple types of epithelium, loose in general. I'm not generalizing it. Like most places, this is the arrangement. Okay, so identify and then just tell me. Now, this is what is written over here. How many tissues are required? 2. One is epithelium. So what type of epithelium do you need? And what type of connective tissue do you need? Dense collagenous connective tissue. So now, this is histology. I'm giving you, okay, think about soft palate. It's behind, am I right? Just cut somehow, open the mouth, take soft palate, cut, make slices, take a small tissue, process it, see it under the microscope. Forget the details. See it under the microscope. What tissue will be there first? What will be the first tissue? Thank you very much. It will be supported by? Now take the hard palate. Cut it, process it, see it under the microscope. What will be the arrangement of tissues in the hard palate? Thank you very much. Now take tongue, cut it, see it. What will be the arrangement of the tissues? Take cheeks, lips, gums, because they are all covered by. You understand? They are all covered by oral mucosa. And what is the structure of the oral mucosa? Like this. You understand? I am not teaching anything difficult. Is it simple or not? Now, in the oral cavity, the epithelium is stratified squamous. Okay, done. This is most places, in most places. But in the oral cavity, there are some areas which are underlined by bone, like hard palate. Like hard palate. These gums which are covering our teeth, roots of the teeth, they're harder. They're not mobile. They're not as mobile as the inner side of the lip or the undersurface of the tongue or the soft palate. They're harder. They're non-mobile. Okay? And they're subject to friction. So is there a possibility of having keratinized epithelium? Possible or not? Yes or no? Whenever there is more friction, there is a possibility that the epithelium, instead of non-keratinized, it can be, I'm not saying always. So the oral cavity in most places lined by stratified squamous non-keratinized epithelium, but in areas there can be stratified squamous keratinized epithelium. So that is why I have shown two types of tissues here. Now what type of epithelium is it? You please tell me. Stratified squamous? Okay. Now lining, forget this. Oral mucosa. It can be of three types. It's very simple. We spend time here and then we'll go like this. My dear, oral mucosa, before I proceed, please tell me, is there any difficulty till here? The tissues, we are just identifying the tissues covering the structures in the oral cavity. It can be divided into three types, 1, 2 and 3. Now what is number 1? Lining mucosa means normal mucosa in most places. Like soft palate, like the tongue, like the lips, like the cheeks. Most of the oral mucosa, in most places, it serves as a lining. It consists of two tissue layers. One is epithelium, second is connective tissue. Epithelium is stratified squamous, non-keratinized. It is supported by dense connective tissue. It is called as what? Lining mucosa. When I'll teach you the histology of soft palate, I will simply mention it is covered by oral mucosa, full stop. Then I will mention third layer. I will not mention the first two layers, because once I say oral mucosa, it means you know. You understand my point? Thank you very much. There are some places where there is bone, underlying bone. So then the mucosa is called as what? Masticatory. Because here its function is slightly different because of its keratinized epithelium, and because of the underlying bone, it's playing major role in grinding. Okay? And the third mucosa is only present on this surface of the tongue, which is called as the dorsal surface of the tongue. It is called as what? Specialized mucosa. But still it is the mucous membrane. The first layer in any case has to be, second has to be, with some special features. We'll discuss all these three. So how many types of oral mucous membrane? Okay. Is it clear? Now see. I'm starting with the lining mucosa. I'll show you slides and explain you feature. You just cooperate with me, you will easily understand. This is the first membrane, the functional membrane with stratified squamous non-keratinized epithelium and connective tissue. You can see here. Epithelium is what? Stratified squamous non-keratinized. Now there is a term here, parakeratinized. Can anybody explain? Any idea about this term? Yes, please.
Maybe the keratin is in layers between.
Anybody else? Yes? It is. Anybody else? Okay. Now what I'll do, I'll show you. Look at this. Can you see this slide picture? This side. This side. What's written over here? And where is the keratin? Yes or no? Yes. Who knows about keratin? What is keratin, by the way? Okay. And what else? Say whatever you say, no problem. There is no harm in just saying. I'm not going to punish for anything. Dead cell, dying cells. It's a mixture of so many things. It's a thick layer. It's all protein. It's made up of dead cell, dying cell. And when a cell dies, it bursts like this, boom, boom. A cell is made up of membranes. Cell membrane, nuclear membrane, membrane around the organelles. So it's a system of membranes. They all boom. So you will see the mixture of all those membranes in this protein as well. Is that clear? Now look at this. What is this? Can you see keratin here? Can you see keratin here?
No.
Can you see some nuclei here? Can you see still a layer here? So this is still keratin, but in this keratin can be seen some of the nuclei of the cells which have not yet died. So this is before dying, but still it's a keratin layer. So like it's a keratin layer which is not completely keratinized. Is it clear? So this is where there is transition. This layer of the keratin which still shows under the microscope some nuclei of the cells, it is called as parakeratinized epithelium. Is it clear? Okay. So but parakeratinized is considered as keratinized. Remember, parakeratinized is keratinized. There is an element of friction. Okay. Now, epithelium is stratified squamous, non-keratinized. In some areas it can be para, or if it is a masticatory mucosa, it will be. Thank you very much. What is second tissue layer? It is called as what? Lamina propria. Lamina propria is the name given to the second connective tissue layer. Full stop. This is oral mucosa. Now, look at this. What is this number 3? It's a new term once again. So wherever there is mucosa as one layer, try to understand. If I'm going fast, stop me please. I need to make your concept clear before we start the other organs. The first layers are already acting as, which is called as mucosa. This functional layer needs support, which is supported by another connective tissue layer, which is called as what? So submucosa is a connective tissue layer like lamina propria, but it is broader, it is even thicker than the lamina propria. It has fibroblasts, it has collagen fibers, it has elastic fibers, it has blood vessels, nerves, lymphatics, everything. It's a connective tissue. Its structure cannot be changed. Is that clear? In addition, it contains some glands which secrete on the surface through a duct. These glands are called as salivary glands because the product they secrete is called as what? Saliva. These are called as unnamed salivary glands. Named are here: parotid, submandibular, sublingual. They are called as what? Unnamed, and they are present throughout the submucosa of the oral mucosa. So if I ask you, do you have salivary glands in the soft palate? Yes or no?
Yes.
Into which layer? Are there salivary glands in the oral mucosa of the cheek? Answer is yes or no? Yes. In which layer? Thank you very much. Are there salivary glands present in the oral mucosa of the hard palate? Yes or no? In which layer? Thank you very much. You understand what I'm saying? This is the inner side of the lip. This side. It's also lined by oral mucosa. Yes or no? Will you expect submucosa here? So if it is submucosa, will you expect the salivary glands here? So it means saliva is coming from everywhere. You understand? And where are these glands present? In the submucosa. Thank you very much. Now, this is mentioned here. Okay, what is number 4? So you know the histology of the oral tissues, it's complete. Soft palate. Is soft palate why? Why it's called a soft palate? There are muscles. So at which layer? The skeletal muscle is present in the fourth layer. What is number 1? Tissue. Epithelium. Second, which is called as? Well, now what is third? What is fourth? Thank you very much. Now hold your lips like this. Start from here. Forget the outer side. Outer side is skin. What will be the first tissue? Second? Third? Fourth? So you know the histology? Yes or no? And how did I start? I said spatial histology is nothing. I'll give you an organ, you cut it, process it, and see how the tissues are arranged. In any case, they have to be arranged in layers. So the oral tissues. Now, whether I give you the soft palate, hard palate, I give you tongue, lips, cheeks, you just have to start from inside out. You understand what I'm saying? Thank you very much. It's just the beginning. I'm trying to give you the approach. Don't expect that I will read, and I'm trying to explain. Yes, my dear.
Is the oral mucosa the first two layers?
Yes. Let's see. There is a difference. For practice, I keep asking you to mention tissue layers so that you don't forget. This is one aspect. But the moment I use mucosa, it's understood that it consists of how many tissues? So once you mention mucosa, so then the second should be the submucosa. So there are two different things. I hope you understand. Tissue layers are 1, 2, 3, 4 like this. But if we consider mucosa as one functional layer, so the second functional will be, and then the next will be muscle or the bone. Thank you for asking this. Keep asking. We have to make our concept clear. This is how we understand. Only then spatial histology becomes simple and interesting. Okay? Now see. So, this is what mucosa? Lining mucosa. So lining mucosa consists of two tissue layers. If you say mucosa, for me it will be two layers. So the second mention will be the submucosa. Okay? And the third will be the muscle or the bone. Now see. This is lining mucosa. Discussion continues. Now what is this mucosa? And I mentioned that masticatory mucosa is present only in two places, whether hard palate or the gingiva, wherever it is. It needs a hard surface, and it is mainly for this. So don't expect that it will be loose, a mobile type of mucosa. Is that clear? So now what are its features? I will simply read, you will understand. Look at this. What will be the first tissue? Stratified squamous? Keratinized epithelium. What is the second tissue? Same connective tissue. But there is some trick here in the palate, especially palate. If you go home, open your mouth, just stand in front of the mirror, open your mouth and see the hard palate. Try to feel, you will see it's very hard. You cannot pinch the mucosa under the hard palate. It's difficult. But the other places you can pinch it. So now what does it mean? If you can pinch it, it's mobile. If you cannot, it means it's tightly adherent to the... You understand what I'm saying? Okay. So the same is true for the mucosa that lies the hard palate. It's of two types. There are some areas where it is loose. You will see some folds. You will see some folds. Where there are folds, it means it is loose. Where it is loose, there will be some mucosa. There will be some. And if it is not loose, so it means lamina propria is directly attached to the bone. Submucosa is gone. So if it is loose, there will be, and if it is not, after this explanation you read this, see. Now deep to the lamina propria is a reticular layer. The term is from the skin actually. Now this reticular layer blends with the periosteum, and there is no submucosa. So what place I am mentioning? The loose areas. Okay? Now see, read this. When there is submucosa, when there is, like elsewhere, like other places, the moment you have submucosa, you will have salivary glands in this submucosa. But in the area where there is no submucosa, there will be. So this is about the masticatory mucosa. Masticatory mucosa is the name given to the oral mucosa. I am repeating oral mucosa hundreds of times, don't get confused. It's simply two layers, arrangement of two layers. Masticatory, where it lies the harder surfaces. Now, look at this. What is this? It is only present on the surface of the lung, not even on the ventral surface of the tongue. The ventral surface has the normal oral mucosa. When I say normal, epithelium, lamina propria with submucosa. This is special. So how many types of oral mucosa are there? Can you mention quickly? Okay. Now, just to create your interest, look at this. Now, my dear, histology deals about the microscopic appearance of the structures, basically. Okay. Now, if we don't talk about the clinical applications, if we don't talk about the function related to the structure, then it becomes boring. It becomes interesting only when you understand the function first and then the application. Okay. You see, somebody, I don't know whether male or female, comes to you, patient, and without even he says something, you can see there is something here. Am I right? He simply comes, sit, you know communication skills, doctor-patient role. We are training you for different scenarios. Patient comes, sit. The moment you see, without even he speaks a word, he simply shows you this. Doctor, see, this is one way of presenting. Okay, or look at this. These are the molar teeth, lower one, and then the patient is showing you. Is that clear? Now, think like a doctor. Think like a doctor. You see something. Is it normal? Is it normal? It's not normal. Am I right? This is how patient present. And now I'm slightly deviated, distracted from histology. No, I'm not. I'm just trying to give you the approach, the clinical approach, the approach of a doctor. My dearest students, whenever a patient comes to you, he comes to you with some complaint. Either he says something, he or she, or shows you something. Am I right? Now, there is something problem, there is an abnormality in the normal structure. Note it somewhere. There is an abnormality in the... What is the normal structure of the lip? You understand? Or what is the normal structure of the oral mucosa here? Do you think, like, are you supposed to see any such thing in the normal oral mucosa? That this is something abnormal. Where? In the oral mucosa. So what is the histology of the oral mucosa? It's covered by what? Epithelium. It is supported by what? And after the lamina propria? Okay. You understand? I'm just trying to give you a scenario. I'm trying to think like a doctor. My dear, what happens? Our body is covered by skin. Skin has hairs. Yes or no? Hairs. How are hairs lubricated, by the way? Sebaceous glands. What are sebaceous glands? Oil glands. Are they associated with the hair follicles? They open into the hair. They keep the hair moist and lubricated. Am I right? The knowledge is sometimes you have sebaceous glands present without associating with the hair follicles. Do you have hair follicles here inside? No. But there are sebaceous glands present in the oral mucosa, in the cheeks, here, margins of the mouth, the lips, the soft palate. This is knowledge. This is information. Where are sebaceous glands present? In the oral mucosa. Sebaceous glands. Do they have duct or they are ductless glands? They have duct. So for a duct, is it possible to be occluded or to be blocked? Yes or no? I cannot teach you the causes. Possibility. Is it possible for a duct to be blocked? What happens when a duct is blocked? And when there is too much accumulation? And when it continues, it will raise the surface or not? It will raise the surface or not? So this raise, we call it as swelling. We call it as what? The glands suddenly become visible. A person comes to you. He is suffering from this condition. His sebaceous glands for some reason are blocked. They are swollen. What are they called? They are called as Fordyce spots or granules. So what is the normal structure? I just explained. What abnormality has occurred? You can see it. If you are a good doctor, you will start thinking like this. Let me give you another example. I am in a mood. I am just giving an example. A person comes to you and says, Doctor, I cannot raise my hand like this. I cannot start this movement. He will not say abduction. He will say, I cannot move my hand away from my body. So what will come to your mind? What movement is affected? Or what part of the abduction is affected? And what muscle is responsible for initiation? This is called as application of knowledge. That is why we teach you anatomy. The patient will not come and say, doctor, I have problem in the anatomy of my rotator cuff muscles. Or can you please check the histology of my soft palate? You understand? So whenever I will come, inshallah, I will teach, I will try to give you the application. So this was just a glimpse. Is that clear? Easy? We are still on the oral mucosa. Now let me proceed. I'm slow. So I think we are done. These are the list of the functions of the oral mucosa. When I say oral mucosa, how many tissues? So do expect that both tissues are contributing in the function. My dear, do you know which part of the body is the most dirtiest part?
The mouth.
Oral cavity is the dirtiest part. Oral cavity is the dirtiest part because normally it houses millions, billions of microorganisms. Yes, though they are our friends, they are called as common cell bacteria, but they can anytime change their behavior and they can be harmful. So we have to control them. We have to maintain oral hygiene all the time. Brush your teeth with some good toothpaste or etc., or miswak, whatever. We have a sunnah for this. Why? Because our Prophet sallallahu alaihi wasallam, he knew at that time that it's the dirtiest part. Without going into the detail, you can see that there are different sources, chemicals, enzymes secreted by the cells, by the connective tissue cells, and even there in the saliva to protect our oral cavity from different organisms. So this is for the function. Please read it again and again. I can ask you any. Now, it's easy. Lips. This is lip. It's a lower lip. It's a lower lip. Sagittal section. This is the outer side. This one, skin side. This is the oral mucosa side, oral side, this side. Here is the tooth. And this V is the area where you apply, and our another counterpart, the females, they apply something here. It's called as lipstick zone. The red area, the vermilion border, the lipstick zone. So it's a transitional zone between the skin outer side, oral mucosa on the inner side. So a lip consists of 3 surfaces. Okay. Now what is this part of the body?
Index finger.
Index finger. What is in the center of the finger? What makes its core?
Bone.
Thank you very much. And the bone is covered by?
Connective tissue or muscle.
Muscle. Outside the muscle is?
Fat.
Which fascia? Deep fascia. Outside the deep fascia? And outside the superficial fascia? This is the organization of the body. Or if you want to go from without inwards, you start with the skin, superficial fascia, deep fascia, muscle, the bone. Okay? Now, if I hold my lip like this, is there any muscle inside or no? Is it soft or hard? Soft. Soft. Is there any muscle in the lips or not? Yes. So look at this M. There is a skeletal muscle surrounding the lip, orbicularis oris. So the core of the lip, the center of the lip is made up of what muscle? Okay. In histology, we cannot name. So for us, what type of muscle is it? And I hope that you know how to identify a skeletal muscle under the microscope. I will not teach you the histology of a skeletal muscle. Done? So what will you see in the center? A skeletal muscle. Now, section can be any. It can be the transverse section, longitudinal section, oblique section. But you should be able to identify what? Okay? Now, start. Oral side. What will be the first? Sorry. Now, what will be the first tissue? Second tissue? So, it will be what? Oral? Mucosa. And then what will be the third? With what? Glands. And what will be the fourth? So do I need to explain you the histology of the lip from inner side? You know it? With the details of the tissue layers? Done? Okay. This is the skin, outer side. What is the first tissue of the skin? Tissue. Epithelium, which is called as epidermis. Like for skin it is epidermis, but for us it is stratified squamous keratinized epithelium with hair follicles, sweat glands, everything. Now, what will be the second layer? For skin, yes. What? But histologically it is? Say again. Shabash. Dense connective tissue, because the epithelium is stratified. What will be the third layer? Hypodermis is submucosa. Okay, for skin it is hypodermis, here it is, and then in the center is what? So whether you come from this side or this side. Now, important is this area, the lipstick area. Normally when you imagine for lips, you only imagine for this lipstick area. You forget that this is also lip, and inside there is also lip. This is lipstick area. It's called as transitional zone. Its name is transitional zone, intermediate zone, vermilion border, red area, intermediate area, any. Okay, now, actually what is this? The epidermis of the skin changes to oral mucosa, like this. So when it comes here, do you have hairs here? Yes or no? So no hairs. What glands are associated with hairs? There will be no sebaceous glands. What other glands are present in the skin? Sweat glands. There will be no sweat glands. So here, the lipstick area is lined by the epidermis of the skin without three things. Can you please name? No hair follicles? No sebaceous? Will you remember this? Plus. Now, see? So, there will be epithelium, but it will be very thin. It will still be keratinized. Stratified, squamous, but very lightly keratinized. Very lightly keratinized. Now, I am done. No, para-keratinized is different. This is truly keratinized. Only difference is it is thin. Okay, now see. I am starting here. What is this? What is the first layer? What is second? What is third? What is fourth? Now, this is lips. What side? Inside. How many layers are mentioned here? Now, my concern is this. So, okay. Now, see. This area, which I have intentionally brought it so that I can show you the intermediate area. See, Allah subhanahu wa ta'ala has designed this area specially. It's called as, whatever name you give, all names are given. And see, even the layers are the same. The first layer is the stratified squamous, lightly keratinized epithelium. It is from the skin, without hair follicles, without sebaceous gland, without sweat glands. The second is the submucosa, the lamina propria. The third is submucosa, and the fourth is the muscle. Now, important points, special features. Even if we don't apply anything, naturally, our lips or this lipstick zone is pinkish. Naturally, it's pink. It's pink. There are two histological reasons for this pinkish color. Number one, because the epithelium is thin, and the underlying lamina propria is very vascular. The moment I use the term vascular means do expect too many capillaries. Too many capillaries, more blood. More blood, more RBCs. More RBCs, more hemoglobin. More hemoglobin, red color. The red color is reflected through this thin skin. So if the color of lips is different in different individuals, it can be because of this thickness or thinness of epithelium. Like if you are a smoker and then there is a stain of the smoke here, so the color of the lips changes because of the deposition of the pigment there. You understand? Otherwise, in a normal, healthy individual, the lips are pinkish for two reasons. You understand? And another important feature is that in the connective tissue of the lips, the connective tissue, the lamina propria, there are so many receptors. Receptor means nerve endings. The ends of the nerve, the terminal boutons, receptors, they act as receptors for pressure, for touch, for temperature, like for different feelings. Is that clear? Lips are highly sensitive. They are used for kissing. The positive side is, it is used by the mothers to kiss their babies, by the parents to kiss their children, by the children to their parents, and you understand? So how does it happen? How does it occur? It means there are receptors. They feel, they inform the brain there is something good. Feel it. You feel it. Of course, they are not for taste. Okay? So see, now, idea, my dear, because this is our first, I'm trying to make it clear to you that histology is a very interesting subject. You know it. You just have to apply it and try to take interesting thing out of it. If I don't explain, you ask me application. That what is the use of this? Why do we know this? The moment you will raise this question, I will give you the reason why do we need to know this structure. Remember, whenever a patient comes to you, he comes to you with some abnormality in the normal structure. Later on, it is manifested by abnormality in the function. Function later on, but initially is some abnormality in the normal. So that is why knowing the normal is extremely important. Otherwise, you cannot become a good doctor. Now, tongue. This is a very important organ. So I'll not start the tongue. I'll just give you the idea that what we will discuss tomorrow. This tongue, you can see this picture and this picture. When it is protruded, tongue is very long. Only this much part can be protruded or can be seen. This part, it's called at the base of the tongue. It's inside the tongue, inside the pharynx. It has an attachment. Okay, please. So it has got a tip, a dorsal surface, margins which are called as lateral sides. It can be divided into anterior 2/3 and posterior 1/3 by an inverted V-shaped sulcus called as sulcus terminalis. So this division is developmental. Tongue develops in parts. It's a complicated development. Okay, so anterior 2/3. This is called as dorsal surface, and the under surface is called as what? Ventral surface is lined by oral mucosa, so there is no issue. The dorsal surface is specialized. We need to know this. This is one. Plus, apparently, the dorsal surface of the tongue, apparently, if we simply touch it, we feel it's smooth. It's not smooth. It's very rough. It becomes obvious, it becomes prominent when our tongue is dry. Then these projections or roughness, it becomes prominent. So this prominence, this roughness of the tongue, you see this surface, is it smooth or there are so many processes here, like bushes? So these are the elevations present on the dorsal surface of the tongue. They are called as, in general, papilla. Papilla is one, papillae is plural. They are called as lingual papillae. There are 4 types of lingual papillae. We will discuss all these things tomorrow. Look at this. Tongue, look at the surface. Now, how many papillae are there? They are named based on their shape. Based on their what? Shape. Look at this. Number 1, filiform. Fili means finger, like finger. Fungiform, like mushroom. Circumvallate. I'll show you here. Can you see this rounded structure? And you see it is surrounded by a khandaq. Khandaq. Trench. A crest. A trough. A moat. A cavity all around. I call it as khandaq. Okay? So this is called as circumvallate. Circumvallate. Around the wall there is a khandaq. And the 4th is called as what? Foliate. Leaf-like. So how many papillae are there? And they are named based on their full stop. I'll show you just for your understanding. Look at this, number 1. This is 1. See? Just name. Filiform. Look at this. Fungiform. Circumvallate. And this is what? Foliate are present over here around the posterior lateral. So we will discuss them tomorrow morning, inshallah ta'ala. Now I will take your 3 attendances.